Hi, everybody. Thank you for joining us. For those who don't know me, I'm Merrin McCracken, the Manager of the Australian Disability Clearinghouse on Education and Training, or ADCET for short. Before I begin, I just want to say that we are live captioning this webinar, and you can access those captions in your toolbar, or we also have captions available in the browser, and the URL has just been put into the chat box. ADCET is based at the University of Tasmania which is Lutruwita. So we'd like to recognise Lutruwita, Tasmanian Aboriginal land, and the spirit of reconciliation. ADCET respectfully acknowledges Lutruwita nations and also recognises the Aboriginal history and culture and land. And I pay my respects to elders past and present, and to all the many Aboriginal people that did not make elder status. I also acknowledge all the countries participating in this meeting or in this webinar, and also acknowledge their elders past and their ancestors and their legacy to us, and any Aboriginal and Torres Strait Islander people participating today. I invite you into the chat to put where you're coming from and to say hello to us all. Today's webinar, Data in Disability Services in Higher Education, will be presented by Dr. Kelly George, who works within the academic governance and standards at Deakin University, and Merrin McCracken, who was a former manager of access and inclusion at Deakin. Today, Merrin and Kelly will share their experiences in using the data available to disability services in the higher education. It's a hot topic, and it's a question we often get asked about. We have a couple of pages on ADCET around data that relates to the vet sector and the higher education sector, and they're well frequented pages. So this is just going to add to the suite of information that we provide to the sector. Before I hand over to our wonderful presenters, just a couple more housekeeping details. As we said, we're being captioned by Bradley Reporting. Michelle's undertaking that job. The webinar will be recorded, and the recording will sit on ADCET, so you'll be able to access that going forward. Also, the slides will be on ADCET. If you have any technical difficulties, you can email us at admin@adcet.edu.au. Presentation will go for around 45 to 50 minutes, and then we'll have 10 minutes or so for questions. As I encourage you to do, to introduce yourself in the chat box and have conversations with each other through the chat. But if you'd like to ask Merrin and Kelly any questions at the end of the webinar, please put that into the Q&A box. That box we're able to then manage the questions from there. It makes it a bit easier. You'll also be able to upvote the favourite questions. So that'll go up to the top of the pile, so it's easier for me to manage the questions that will come in. This is the first of this series, so we'll have another webinar next week, and Merrin and Kelly will speak more about that at the end of the webinar. But okay, now I'm going to throw over to both of you, but I think you're starting, Merrin. So thank you, Kelly, thank you, Merrin, and look forward to hearing this chat.
Thank you, Darlene, and hi everybody. It's lovely to join you. Kel and I are joining you from the lands of the Wadawurrung people of the Kulin Nations, and we pay our deepest respects to their elders past and present. And I also wanted, our topic today is data, and the sad truth of it is that Aboriginal and Torres Strait Islander people are overrepresented in our data around disability and health and medical conditions. So I just want to acknowledge that as well before we get started. And now a few things by way of introduction. So as Darlene mentioned, Kel and I are drawing on our Deakin experiences, her current ones, my past ones, but not too distant past. And I thank all those Deakin people there for allowing me to still do some work under that name. We've worked together over the years, Kelly and I, and really explored our use of data and how we can help each other in this way. So we want to share some of our experiences today and also next week, and some from other universities again next week too. We're also drawing on the information that we got from the survey that a number of managers across universities contributed to a couple of months ago. I want to also note that a lot of what we cover today will be really familiar to a lot of you. And there may be much more that you can add to this story. So, you know, whether that happens in the chat, whether it happens afterwards by contacting us and so on. But we also thought it's just really useful to sort of look at those fundamental sets of data that we use and record it, I guess, as a resource for ADCET for people who may come into the roles into the future, and also as something that we build on. We're looking today particularly at higher ed data, and in particular we'll cover the department's higher ed statistics, our own service data, and the quality indicators for learning and teaching surveys. We're not going to look at the large societal data like the Australian Bureau of Statistics or the Australian Institute of Health and Welfare stats. There are links to those on ADCET, and in a little while we'll spend some time with ADCET and just make sure we've got the most up-to-date areas there on the ADCET website. So not the big national data sets. And just by way of introduction, I just wanted to talk a little bit about data and why we use it and when is data good data. So first up, why we use our data. So and there's more we could add to this, I'm sure, but data really helps us to meet our obligations. It helps us to inform policy. It helps us to identify priorities for action and for further research, our own research or in combination with other researchers. We use it to evaluate our work, and we can use it to hold people and areas to account and to provide feedback. And when is data good data? And this is where our planning unit colleagues can really help us if we aren't very proficient in data, which I don't pretend to be at all. But data is good data when it's collected consistently, when it is a big enough data set for purpose. And that can change depending what the purpose is. And again, I would often refer to colleagues who are researchers or to the planning unit to say, is this data relevant to what I'm trying to find out? Is there enough, or is the set too small for us to draw any conclusions from? Data needs to be, we need to be careful not to use data purely on its own. We need to consider the context and also apply a sort of scrutiny and challenge the data and the things that it's telling us. That's the next one, Cal. So we're going to start with higher ed statistics. What are they? So these will be very familiar to you all, I'm sure. The Australian Department of Ed collects and disseminates statistics relating to the provision of higher education at all education institutions. And now we've just gone to the web page, the cover web page on the higher ed stats. I meant to say to everyone in the chat, we've put the links that are also in this presentation. So at a couple of points, you might choose to actually go in and follow what we're doing on the links, or just watch as we navigate them along. So this is the front page of the higher ed stats website, and it tells us a bit of background about those statistics. It tells us that they're a comprehensive set of statistics managed in the higher ed collection. And the data includes a whole range of things, some of which we take more and less notice of. So it tells us about the courses provided by higher ed institutions, the numbers and characteristics of students undertaking courses. And this is the one that, we'll look the most at. But it also has information about student load, about completion of units of study and courses, student liability status, numbers and characteristics of staff in higher ed institutions. I didn't know that. Income and expenditure for higher ed institutions, research activity, and undergrad applications, offers and acceptances. So how is this data collected? And I want to talk just a little bit about, we had some feedback from people in the survey about the enrolment data that all of our universities collect. So we know that the statistics are gathered through the enrolment data that every university has, and the department provides a set of questions that must be considered in that data, and particularly around disability, a range of different disability types. You interrupt me if I'm missing anything or getting anything wrong here, Kel. We know that data can be a little problematic. In talking to the different universities, we find that some of them are using the standard definitions that the department provides for the collection of that data on enrolment, where students are asked to indicate themselves. We find that other universities have added some additional categories and then mapping them back to the department ones. And some of those additional categories include students who are carers of people with disabilities, students with ADHD, autism and neurodiversity, and sometimes more breakdown on vision and hearing impairment. And from that survey, we had a couple of quotes, and these will resonate for you, of course. You know, some of the problem is that disclosure is voluntary and many choose not to disclose. It only occurs at the enrolment stage, which doesn't capture disabilities acquired while studying. International students are particularly concerned about how disclosure will impact their visas. Students are responsible for updating disability details. We included it as a step in our registration process, but some students just don't do it, but we provide a service anyway. So we know that some of these are problematic. We know that they're not complete or accurate, but they're jolly big sets of data. So the little bits that aren't collected probably aren't affecting the stats overall. Nod, Kel. But it's also important for us as disability providers. We'd like to see them as accurate as they can be. We know they're not complete or accurate. Students choose not to share. They're not often updated. We have a real value dilemma in this area, I think. You know, in so many ways, we'd like it to be that students don't need to disclose or share that they have a disability. We would like our environment to be inclusive and there'd be no need to do that. On the other hand, I think it's really valuable for us as big institutions to be aware of how well we're representing the society that we're in and reflecting that broader population. So for that reason, I think that data is really important. We know that the numbers in the higher ed statistics have increased significantly over the years. And if we just took that data on face value, it might say to us, oh, there's so many more students with disability studying at university. But I think we all know it's much more nuanced than that. Yes, I think there are more students with disability studying at university. Maybe there's more students who are needing assistance and needing to tick that box. There's much greater awareness over the last few years of medical conditions and mental health conditions being part of that cohort for whom we can provide some support. And I think that, you know, I would reflect that our experience of the general use of access plans now has really encouraged the identification of students with disability in order to get an access plan, to get adjustments, when in the past perhaps those adjustments might have happened within particular units. So we're going to now have a look at the higher ed stats, and Cal will help to drive us through that. If other people would like to log on to that link, you're welcome to, or you can do that later and have a look, or you may well be very familiar with them. So we're going to have a look at the 2020 stats today. These are an interesting set because, in fact, they're a set that we think there might be a few little problems with, but nonetheless, I think it's useful for us to have a look at them. And where are we going to start, Cal?
I think we'll start with section 11, equity groups. So if I click on this and open it up.
So just before you open, or while it's opening, just to note the different equity groups that are there, that are part of this data. And again, you will all know this, but for the record, there's a number of equity groups. And because they're included in this data, it allows us at planning unit and institutional level to do some work on looking at intersectionality as well with people from low socioeconomic backgrounds, Aboriginal, Torres Strait Islander, regional and remote locations.
Okay, so this is section 11, opening so generally I've jumped straight into table 11.1. This has domestic students that are commencing as well as all domestic students. There's a number of equity groups down the side here, and you've got a bit of a time series across the top. These are whole numbers. So you can see, as Merrin was saying, in 2006, there was roughly 28,000 students with disability. In 2020, that was up to 84-ish thousand. So there's been a steep increase. The next table we'll look at provides a breakdown by university and state. So if you look in column D, you can look across to your institution, find your whole numbers of students with disability.
So these are all students, domestic and...
No, it's only domestic.
Only domestic,
yeah,
but commencing and continuing students.
That's right.
Yeah.
Yeah. So that's a different, based on the contents, you just pick the one you want.
Yeah. And is there any collection of data around international students?
We have the data internally, but it's not published.
Yeah.
I think there's a legislative requirement from the government to make sure that we track all this information, but it's not so for international students. So there's the whole numbers there. If you want to learn about percentages of your students with disability at your institution, you need to jump into a second spreadsheet. So just click off this one.
And just to interrupt, please, if anyone's got any questions about any of these things as we go, if you can put them in the Q&A and we'll return to them at the end.
Yeah. So the other section that's really helpful for looking at students with disability is section 16, equity performance data. So let's open that up.
I think this is the one I would go to most often, and probably all of our teams and managers use the most. While we're on this contents page,
yes,
could you do a little recap for us about the definitions around access, participation, retention and success?
yes. So access numbers refer to the number of commencing students with disability or from any equity group. And the access rate is that number expressed as a percentage of all your commencing students. Participation is essentially the same thing, but we're looking at more than commencing, so that'll be all your domestic students.
So that's the one I think I use the most, because that tells me the full numbers.
Full picture.
And it's undergrad, and you can get it undergrad, postgrad, and together.
Yeah, so it looks like here we've got all domestic, and then there's a breakdown for just undergrads.
Yep.
Then you've got retention, which looks at the percentage of students studying in 1 year that return the next year to continue studying. Success is a representation of unit success. So it's the number of units that are passed out of all units taken rather than a successful completion measure.
Yeah,
So
that one has always confused me a bit. Can we get completion figures as well?
There is this award course completions number, which is table 1610, but I have a few issues with it because it's not standardized by length of course or starting date or a number of things that can affect how long it takes.
And if people move from one course to another.
Exactly.
Yeah.
So there is other areas that you can go to get to that, but I think that might be a bit too much for today. So if we go to participation rates, that's like the key statistic for comparing yourself to other institutions. It's a huge time series with all equity groups, so I just need to find a couple of things.
For people who love Excel data, these are really fun things, but if you if you're not really proficient at it, a planning unit person could be very handy too. And Kelly, you've done lots of work with these tables to develop graphs and all sorts of things for us. Yeah.
So these are your participation rates. So that's the percentage of students with disability at your institution per year. Do you want to talk about that?
Yeah, I just did want to touch on the 2020 data just briefly, and just to indicate that we have got a few. There's a few universities, not many, but a few of them, and Deakin's one of them, where we're concerned about the data for 2020. And if you look across this rate, it's saying, you know, what the percentage of students with disability are at Deakin, and in 2019 it was nearly 9%, and in 2020 it dropped back to 4.9. Well, it actually didn't.
No.
And we know that. So we were just a bit concerned because this data is used by very many people to sort of make sure it's accurate. I think we're still working, I think Deakin is still working with the department on updating that. But it's one of those things I mentioned earlier about opportunities for us to work as a sector on things. I think it's really important that that we emphasise with the department that this data is very important, not the least because some of our funding is reliant on it as well, but also because it's so useful in so many research ways. What other things? I think that, you know, that I know you've done for me some graphs, and we'll show some of these next week, but that shows the trajectory of the increase, you know, from, even if we don't take that full stretch of timeline, but even over the last 5 years or 5 to 10 years, the trajectory of increase of percentage of students with disability is a really steep curve. And if we compare that curve with a curve for the growth in all students, we see a very big difference between the growth of students with disability and the growth of numbers of all students. Is there anything else on this one?
So I guess because it's got all institutions, there's the state total and the sector total, so you can look at yourself in comparison to those totals. I guess next we want to go to 16.8.
So we're now looking at table 16.8, which is equity success rates for domestic students.
So when it first opens up, this domestic national total, that's the success rate of all students. So we just need to scroll across for disability. So we'll just take out this, these guys again. So now we can look at all domestic students in this column against students with disability in that column. We'll cut down a few extra years.
And probably the success rates are one of the areas where we see the biggest gaps.
Yeah.
Between all domestic students and students with disability.
So essentially we're looking at this column compared to AN column, and you can see that there's quite a drop between all students and students with disability. Again, you can look by institution, state, sector total, lots of options for you to look at, and there's also the other equity groups if you wanted to do that.
Yeah. So the difference here of table A providers, which is all our usual public universities, of 88.37 compared to 82.35, and that would be a sort of statistically, what's the word? Significant difference. Yeah. And again, more on this. We're just having a look at this today, but more on this next week. But just to sort of flag, these are some of the areas where we might talk with faculties or use them in our disability access plans about some of the gaps and what might be some of the things we can do to close that gap and get those success rates up. Thank you, Cal. What next?
And this one's the retention. So a similar process with.
So now Cal's just hiding a few more columns so we can have a look at the comparison between the domestic totals and
that's all students there, and that's students with disability. So you can see that the retention is a little bit lower for students with disability in most cases. Yeah, so that's another key measure that we look at. And this data, as it's publicly available, you can do benchmarking against yourself. But if you get in touch with your planning unit, you can do more rich comparisons at an institution level. Yeah.
Thank you, Cal.
I think we were going to have a quick look at those.
The visual analytics. So, I mean, just a little comment on retention. That is probably one of the areas where we see a little closer.
Yeah.
We see students with disability a bit closer in terms of their retention rates.
So this visual dashboard that the department's prepared, it's sort of like a dynamic representation of those spreadsheets that we just saw. But there's a few extra complexities because it's a bit more dynamic. So you need to click on a few things to get to what you want.
We're just having a really tiny little look at this. And I think all it will do is show that it's quite complicated. But if you spend a bit of time with them and playing around with them and maybe working with someone who knows how to use them, yeah, they can be quite useful.
There's also the Neshi one.
Yes. So that the other data set that is a bit like these visual analytics is the National Centre for Student Equity in Higher Ed, the Neshi link, which is on the ADCET site. We haven't included it here, and partly because they actually haven't updated their numbers for 2020 because they were a bit concerned that they weren't 100% accurate as well. But that is quite an easy, we'll put that link in the, perhaps in the chat, and I'm not seeing the chat, but Gab, maybe you might want to put that link in there. It's quite an easy one to have a look at so that you can see how you're progressing. You can have a look at some comparisons, and it's a really nice visuals that you can take to show what's happening to other people who in your university who may not have looked at that site. I find that it's, you know, it looks great, and you can really use it to sort of demonstrate the points that you might be making in talking with others in your institution. So that's our higher ed stats, Cal.
Yep.
So the only other thing was to mention how planning units can assist, and I guess we've covered that quite a bit, really. I think that what I have found over the years is how useful it is to go to the Kellys of this world and just say, look, help me understand this, or can I dive into this a little bit more? Or there's all those permutations and combinations of all that higher ed data that's there. And as we go on to look at our own service data, we'll see how much richer that we can add to that.
And one other thing, with your institutional data, you can look at intersections between equity groups. So looking at Aboriginal and Torres Strait Islander students that also have a disability. These things you can't pick up in the publicly available data. They're just strictly one equity group.
Right, thanks, Carol. So now we're going to have a look at section 2, which is our own disability service data. And again, I'm going to draw on some of the results that people gave in the survey. So what are they? They are the information that we collect from students who use our services, and some information about the services that we provide. Some of them also include information about what students are studying. And as we know, they're not a direct overlap with the higher ed stats. And I guess we've touched on already, you know, there perhaps are some ways that we can look to bring these figures closer together. Updating enrolment data in the survey, people told us they were doing some different things. So some universities are now asking students to go back in and update that enrolment data. Some of them are seeking and getting permission from students to go in and update that enrolment data themselves. I know at Deakin we've recently implemented a sort of semi-automatic report that comes from our service data to the general enrolment data and does an update each month of that. So again, you know, things that would be really good for us to have a think about as a sector and think about whether we can bring our practices closer together in that. And I really welcome people's ideas around that. So how are they collected? Along with student numbers, there's just so much more that our systems can do now. And that's something I think that, you know, over 10 or 12 years, we've seen enormous advances in what our data systems can do. It's not to say that they're perfect yet, but golly, they're much more than they used to be. Some of them link to other student management systems. And we'll look now at a little bit of a summary of the survey responses about our own systems that we've been using across the sector. And I think there were responses from 15 universities in that survey that don't give us a full picture, but it give us a bit of a sense. So the systems that we're using to collect information, Simplicity is the most common, and there's a number, and I think I'm not sure yet whether there's a community of practice developed around Simplicity users, but I know that was in the cards. There's a couple of universities using ServiceNow, Point and Click is another, and Oracle. And then there are a number that have their own individual systems. So we haven't got commonality of systems across our disability services, and I suspect we never will because of the different systems that are used across all the universities. But on the next slide, we'll look at the sorts of things that we're collecting. And I do feel like this is the thing where we might be able to and we are becoming more common in what we're collecting, so that the ability for us to benchmark and compare and share is much greater. So of the 15 responses, this information from the survey, all 15 were counting the number of students. Most were assessing the disability information in type, including being able to record multiple disability types. 13 had information about the number of access plans delivered. 12 had a bunch of information about the types of accommodations and adjustments that students were receiving. And that's a really useful piece of data. Researchers love that we have that. All 15 had the number of appointments, and the hours of services provided were largely around the hours of services provided through the appointments. 4 were recording the costs per students, and most of them, again, were looking at the ratio of students to advisors. Some of them were also collecting things like information about assistive technology and equipment, faculty and unit details, and referrals on to other areas. We also asked people what works and what could be improved. I guess in general, people were saying much has improved, but systems can't seem to do all we need of them. Some are not well supported by the university, or staff are not well resourced to use them for reporting. And there's none that capture the time spent indirectly on behalf of students. There may be some out there, so there weren't in the 15 respondents. So if anyone has got that, let us know. Here's a couple of quotes of what people said. It's manual data entry with a high risk of error. And as one system is being used for many different purposes, there are data errors due to filtering issues. We work across 2 systems that don't talk to each other. One system doesn't link to the student system. The reporting capability is very limited and requires significant IT resourcing to create the level of bespoke reporting that's useful. I can't create ad hoc reports, which I find limiting. What works? Capture data related to type and nature of disability, the ability to monitor interactions with students, monitor trends with units, faculty and types of adjustments, peak times for appointments, year-on-year comparison. What doesn't work is an analysis on time spent in an interaction or supporting a student. Reporting is clunky and inconsistent, and there's no support within the university on its use, and external supports are often not existent. So they're the sort of themes that came through from our survey around our disability service data. But given all those things that could be improved, there's still an enormous wealth of data that sits in those systems. And again, we'll have quite a big look at that next week when we see some of the things that, that can be done. So how can planning units assist? I think this is another area, not just planning units, but other people within the university. So Deakin, for example, was using ServiceNow, as a number of other areas of the university are, and there are some people who've really developed expertise in that and have helped us to work out how to get really good reports from the system and so on. Cal, we've sent you big export masses of data from our database at times and had you play around with it and you know, interrogate, I guess, some of the data that we've had and come up with some good things.
It's possible to link it to your student outcomes, so you can look at success rates versus different measures that you collect. So there's a way to delve into it further. Yeah.
And also to do that comparison about the higher ed stats and our stats, and to see how many students fall in the overlap or out of the overlap area. Yeah. And this data, of course, provides us really our standard functions like distribution of access plans or there's data and systems, distribute access plans, consider caseloads, and help us with our reporting to the department. I sense that there are so many other uses for this data in research, planning, policy, and telling the story of students with disability. I know it's a little bit dream world to think that we might have the time to use that, but I guess it's one of the reasons for doing this session is to sort of encourage us to share where we have used some of those things to tell stories, to help us identify students we want to hear more from, and all of those sorts of things. So we're now on to our quilt surveys, Cal. So just by way of introduction, these are a set of national surveys that are run by the Social Research Centre, but they're contracted by the federal government to provide this information. I guess they form another set of data around higher ed.
Yeah.
So there's the three, I think there are only three in this set, aren't they? So QUILT stands for Quality Indicators of Learning and Teaching. Go on.
Yeah, so the student outcome, the student experience survey looks at student experiences throughout their study. It asks things about student support, teaching quality, development of equipment, that sort of thing. And that's looking at students who are current, whereas the graduate outcome survey is a survey of students after they've completed, and it measures short-term employment, while the graduate outcomes longitudinal is a similar one to the GOS, but it's just a further time point outside of completion. So I think it's 3 years. So we're looking at short-term and then long-term employment, so that you can have a look at how your students are travelling compared to other students.
And they're sort of national campaigns, but the response rates, it always surprises me, are actually not that bad. You know, they're being sent to students, and can you remember the sort of response rates that we would get? You know, if they're going to 60,000 students at Deakin, for example, is it?
We usually get around 30%.
30%, yeah, it's pretty, so they're big numbers. So Cal's going to show us these reports, so the link is there again. And this is a set of reports that I actually didn't know about for years, and probably found out about them, you know, 5 or 6 or 7 years ago, I'm not sure. And then started to think, oh, I wonder if we can look at these through the lens of students with disability, as there's such big surveys that are being run. And sure enough, went and talked to Cal, and she said, yeah, we can.
Yeah, so they're rather large data sets, but they have all of the equity information, as well as in your own institution, you'll have course, faculty, a number of different things that you can break it down by. But just if you want to just look at students with disability overall, just jumping into the Cook National Report is pretty good.
So these reports didn't used to bring out the information about disability,
No,
but they have in
the last
couple of years.
Yeah. So I generally so I usually just do a control find to search for mentions of disability, and then you can see these are the scales that students are asked about. So there's skills development, learner engagement, teaching quality, student support, and learning resources. And you can see that students with disability report a slightly lower experience than students with no reported disability. It just shows something to be aware of.
Teacher quality is pretty good, and student support looks pretty good.
Yeah, they're usually quite good. And then there's like your overall experience is only 3% different in the sector, so that's not too bad.
Yeah. You can dive into these a little bit. Oh, is it this one? You can dive even further into the specific questions, so you can see where the differences lie.
So each of these scales is made up of about 4 or 5 questions, I think, and then they turn that into an overall scale. So you can delve right into the underlying survey questions that make that. You just need to contact your planning unit. Your planning unit, they'll get an institution data set, so it's all your students, and you can link that to success and retention data, that sort of thing. And they'll also get a national data set, so you can look at overall trends in the sector and with institutions similar to yours, that sort of thing.
And I would come to you and say, can you have a look at this, and are there areas where there are significant differences between the experiences for students with disability and students without disability?
Yeah.
And again, sort of really interesting to when you're talking with other areas of the university, say in teaching and learning, considering inclusive ed or developing access plans and all of the action plans and those sort of things. Yeah, so is that it for the student experience survey? And these are annual?
Yes. Yeah. Yeah. Okay.
So, and you're now back to seeing the quilt headline one, and we're now looking at the graduate outcomes survey.
So it's a similar setup. They have a bit of a summary of the results in a bit of a Power BI thing. I don't know that it's interactive. It just, I know there are some things that you can look at. I don't think it goes to the level of disability in that particular slide, but if you go down to download the report again, you'll be able to. And again, I would just do a word search on disability or low SES.
What, you're not going to read the 60 pages in grade.
That's right. But this report does show overall employment, part-time, full-time employment, that sort of thing, further study. So there's a lot of information that you can get about students with disability.
And we had a look at one page of this yesterday. Can you remember which one it was?
What's that one? SES.
I think it was the employment that was talking about the 11% gap in students.
Yeah, 11% students.
And again, these are things that we know, but it's very useful to be backed up by some stats when we say talk to our careers people, and look at making the argument for some more work in this area. Yeah, cool. Thank you, Cal. The last one is the graduate outcomes longitudinal, which is
a similar. It's the same question set. It's just asked a further 3 years out. So you expect that people have progressed in their career, so they might be earning more money or have progressed to different jobs.
Yeah. So we won't have a look at that one today, just for time's sake. So again, I think you've touched on, Kel, how planning units can assist here, finding out that, looking at things through a particular lens. And again, I guess with cautions around the conclusions we draw from these things, you know, they're more sort of indicating things that we might want to investigate more or talk to students about their experience, and, you know, make sure that we're not just drawing conclusions directly from the data. It's a large data set. It's really useful at a strategic and planning level, I think. And just before we finish, which we're getting close to, I just wanted to comment on, there's, of course, individual universities do their own set of overarching data as well. So things like student satisfaction surveys that the university does just for itself. Getting started is one that we do at Deakin, which is just about students' experience of the first 6 to 8 weeks or trimester of study. Some equity and inclusion or equity and diversity units might do some very specific surveys of students. And again, these are things that it's really useful to ask whoever's running those surveys. One, to perhaps be involved in what some of the questions are, but two, to have a look at the outcomes through various lenses, including a disability lens. So, we've just mentioned a few sort of potential opportunities to explore further as a sector. And I think, you know, perhaps there's some ways, and Darlene, I know ADCET is incredibly busy at the moment, and I'm not sure if the time's right now, but having a look at, you know, perhaps how we might share the way we're collecting that enrolment data and sort of make sure that it's apples and apples on those lists. And again, I think the differences are probably small, but they make a difference when you know, that data is being used to allocate disability support program funding, or when we're wanting to draw attention to, you know, various things in our own institutions when we're making some strategic points, I guess. I'm not sure, you know, we worked with the department some years ago to improve and include particularly the mental health category. That has made a big difference to what we can do with that data, but it might be useful to have a look at improving those definitions again, and particularly in those areas of neurodiversity and carers, where students at the moment are sometimes not seeing themselves in the questions that are being asked. Improving that correlation of higher ed and disability service use of stats. And one of the areas I think that we've struggled with a little bit was just really making sure that we had good consent statements from students if we were going to be updating that information on their behalf. So being clear that students were really clear that that was it, that it was de-identified, and making sure, and, you know, perhaps sharing some practice around that. And the other thing I thought about was developing a complete and growing wish list for our systems, and maybe a community practice around reporting and support into the future. And so next week, just to mention next week, we are going to have a little look at more practical examples of how we've used data for planning, how some of our research areas at Deakin have worked with us to do some research and use some of the data that we collect at a service level. Mental health strategy development, course reviews. I don't know if we'll do the estimating the disability support program funding, because it's a very tricky thing to do. And now I guess we just want to invite some questions, comments, any other ideas that people have. Thank you, Darlene.
Brilliant. Thank you so much. It's I always get excited by data, but then
You either do or you don't.
Yeah, then I got unexcited by all the Merrin's Christmas wish list of what we can do. It all seemed like work, but no, it'll be great work, and it'll be fabulous for next year to look at a priority and bringing some of those wishes to fruition. I'll also add it to my Santa list, and hopefully they'll listen to us. Okay, we had a couple of questions coming through. We encourage people to put questions in the Q&A. Just from Elizabeth, do you know what may the impact of not having the data of 2020, you know, true and correct for everybody? Is there, you know, impacts that you see for us as a sector by not having that data true and correct?
Well, there's a couple of things. There's immediate ones because of that disability support program funding, and we know that that's the data that's used for them to allocate. I always get this a bit wrong, but 55% of the disability support fund money is allocated proportionally to each university based on the numbers of students with disability that they have. So if that data is inaccurate, if it's over or under, it means that the proportion of funding isn't going to be correct. I think, you know, when you look at something like the NESHI and timelines of data, you know, they're just skewed if it's not right. You know, if we see a funny dip or a funny rise, I think that we need, and Kelly, you might want to say what you've been discussing with the department.
I'm hoping that the data will be updated when the 2021 comes out, so there won't be that dip. But if we don't get our way, there will be the drop, but then it will go back to what it should be. So there'll be a huge increase. Yeah.
And look, I do think that there were some just very specific problems. I know at Deakin, it was around the crossover into using the TAXI, the tertiary collection student information systems that have been introduced over the last couple of years. There were just some system problems that made it problematic, and we did actually wonder whether I think, what do we use? Tribal, that there might have been, you know, particular issues for some universities. So I feel like it's probably not I think it's had impact on particular institutions, but I think for many of them it was probably accurate.
Okay, thank you. Elizabeth also asked about any links. Is there any links to your findings? Just so from the survey that was undertaken, is there anything that we're going to produce from that besides this webinar? Or
yeah, no. Look, I think what I'd like to do is just write that survey report up, and perhaps we can add it to this. The notes for this webinar,
yep, the suite of things
to do it. So that we have got some summaries of it, but I think it just needs a little bit more moulding, and we can write it up a little bit more.
That'd be brilliant. Charlotte's asked, when institutions look at staff-student ratio, are people looking at numbers or registered students with disability services who total institutions enrolment, or both?
Yeah, interesting. And I don't know the answer for everyone, and I think that's a really interesting question, because the way we, you know, I guess that we have in the past, and Steve and Nick may well be in this webinar, and their role now, but we have looked particularly at students who are registered with our staff ratios. But I think there's a very strong argument to be made because of our role in working around promoting inclusion and, you know, looking at disability awareness and education, and not just the individual work with individual students who register with us. I think the arguments can be made equally for both sets of data, really. And I think if there is a particular difference between the students who are getting individual support compared with the broader cohort, it's a good argument to make for why, you know, we need to be looking at working on inclusion and other approaches as well.
Yeah. Benchmarking is such a huge thing for us at the sector. We're still kind of coming to terms with the structure. Yesterday, participated in the University of Tasmania, did a staff engagement survey that was actually, it's an international benchmarked survey. So, and it was fabulous to see the data about how poorly we may do or how good we do, and benchmark that against every other university that has actually undertaken this survey. And I just got so excited thinking, imagine even, you know, in Australia wide that we could actually, you know, had the money to build a tool like that we can really clearly kind of have that stuff benchmark, which would be, anyway, that's on my Christmas wish list.
Yeah, and I think that's the sort of thing that, you know, if we were all, even if we're using different systems, but we're asking, collecting the same or similar information, and not just nationally, but internationally as well. I'm afraid in my little foray to Norway, I didn't get to the Oslo or the Bergen universities, which I was hoping to do. But you know, I think there's huge opportunity for us to be looking at what's happening internationally as well, if we're collecting this data in a sort of consistent way.
What a beautiful person you are, Merrin, going on holidays and trying to break down the doors of the universities to where you go. Just one question we had in the chat also was that I note that in section 11 it includes non-unis, but in section 16 is only table A and table B. That was in one of the data sets you showed. Is there why this would be?
So Universities Australia has an agreement to get certain types of data that we're allowed to access. And I don't think that the newies are involved in the second one. That's why we don't have. It's a University Australia's agreement, and there's just one thing that's missing. That happened well before the new HEPs came across. So I think there would need to be a new agreement put together if we wanted to have both.
Okay, great, thank you. And there was a question around long COVID, just in the yeah, if it's being considered as disability, it's probably outside of the scope, but I didn't know if you wanted to make any comment around, you know, if long COVID is presenting and that's being received as, you know, people identifying with as that impact in a way that, you know, they would identify as having a disability.
And look, the only, it's probably not for me to comment other than to say I have seen a few discussions on Ofsted, and clearly it does fit, it would fit into the definition around, you know, medical and health conditions, and would qualify in that sense to the disability, disability.
Yep.
And I'm gathering that a number of universities are seeing many, you know, an increase in students presenting with long COVID.
Yeah, no, definitely. All right, well, that's all we've got time for. Absolutely fabulous. It's got me all, my appetite has been wet to go into and look at more data and kind of cut it up how you guys have done it today. So that's brilliant. We've put a link into the survey. Please fill that in. We really, you know, love to hear your responses, also to get ideas. But the most important thing is we have the webinar next week, which will, that will provide an opportunity for kind of more ways to utilise the longitudinal data and so forth.
Just before we go, can I just say there will be some people I'll be in touch with over the next few days, and if anyone's got anything they'd really like to share next week, so some practice that you've done or a way you've used your data, please just contact me and let me know over the next few days. That would be fantastic.
That'd be great. So that's on the 25th of October, 1 o'clock AEDT time. So look forward to seeing you all again then. And thank you so much, Kelly and Merrin, for a great presentation. And we're just seeing all the great feedback in the chat for how much people enjoyed it. So thank you. Have a great day.
Thanks.
See you all. Bye.
Bye-bye.